Parts of Latin America are finding a new normal amid the pandemic. But tragedy remains a reality for many. Brazil has seen the highest number of coronavirus cases in the region. Officials there say the virus is under control and are even closing temporary hospitals, like this one. But more than 130,000 people have died during the pandemic so far in Brazil. Why has it been a hotbed for the virus? The pandemic is also putting the squeeze on Latin American livelihoods. Can governments help their citizens make ends meet? And we begin with a look at Brazil, where a lack of government response has devastated the most vulnerable groups, in particular those living paycheck to paycheck, often in the informal economy. Left to try and fill in the gap are community groups.
People are angry about President Bolsonaro's right-wing politics, about exclusion and racism, about the many COVID-19 deaths, and about the fact that nothing is being done about it in this country. The protests are led by ultra football fans of the Corinthian Football Club. Every Saturday, the fans cook meals to help the poorest people, those who have been hit hard by the pandemic. Today alone, they will distribute 1,000 meals on the city's streets. They deliver the food packages in their private cars. They head for the center of Sao Paulo in a convoy. For these homeless people, the free meal is a blessing, with its rice, pasta, and sausage. They have only been homeless for a few weeks. They could no longer pay their rent due to the coronavirus crisis. They are Brazil's new poor. The government should come out of its palaces and see with its own eyes what is happening in this country. Brazil's President Bolsonaro, who usually appears without a mask, continues to downplay the coronavirus risk. He has also been criticized for not always publishing the number of victims. The number of unreported cases is especially high in the favelas. So in Rio de Janeiro, residents have started their own count. Many victims of the virus in our favela weren't counted by the health authorities. We have a few examples of that among our circle of friends. The volunteers talk to their neighbors and note the cases. Many are part of the unreported number. There are some COVID-19 cases here. Some survive, others don't. With the help of numerous favela residents, the volunteers compile their own lists for their poor district of Borel. They also collect data on sick people via WhatsApp, something the city council does not do. Since the favelas appeared, the government is conspicuous in its absence. We always have to reinvent ourselves and break new ground. As other football fans in Sao Paulo, here under a highway bridge at 10 p.m., the ultras go where hardly any others would set foot. Cars drive across the bridge above, while down below, families in need have built a place to live. They too are among the pandemic's new poor. This family brought a kitchen cupboard, a bed, and a stove from their rented apartment just a few weeks ago. Now they can only hope for better times, and that the ultras' important help will not stop. During the crisis, I could no longer pay my rent. My wife and I became unemployed. We have 3 children, so our only option was to come here. I built this shelter myself. With poverty comes fear of the virus and of being left behind during the pandemic.
And I'm joined now by Marika Blofield. She's director of the Giga Institute for Latin American Studies in Hamburg, which is where she's joining us from. Marika, it's good to have you on the show. The lack of government help for Brazil's poor during so much of this pandemic, has that been by design or by omission?
Well, I mean, actually, the Brazilian government overall hasn't been completely unattentive to the needs of the poor. And that's been actually not by the design of the executive government, but the opposition back in late March. So right after the pandemic started, the opposition and civil society came together and pushed through emergency cash assistance. And the government did not veto it. And as a result, actually about 1/3 of the Brazilian population currently receives emergency cash assistance from the government, which is the highest level of any Latin American country. However, of course, it doesn't meet all basic needs. While it's relatively sufficient enough to buy food, it doesn't necessarily cover rents and such. And so still people, for example, in Sao Paulo who lose their jobs are still in dire economic straits. So there is a social protection floor in Brazil. But of course, it doesn't mitigate all the devastating effects of the economic crisis. And this has been pushed through by the opposition rather than the government.
Why have we seen COVID really take off in Latin America? It seems like in comparison to some other regions, there was a bit more of a delay before cases really took off, and still things have been pretty bad in countries like Brazil. Can we pin that on any policies or on any, I don't know, what do you see?
Well, I'm not an epidemiologist, but I can tell you this, that humans are vectors of transmission. And so social distancing measures have really helped to mitigate the spread of the virus. However, if you implement social distancing, you absolutely have to also, especially in poorer countries, make sure the families have the means to feed themselves while they stay at home. And in countries that can't do that, you can't expect people to stay at home and starve or watch their kids go hungry and not go out on the streets and try to make an income. And so that's one of the key challenges that Latin American countries, as well as all developing countries, have had, is how to make sure that people can actually adhere to the social distancing measures. And in a region with very high levels of informality in the workforce, about half of the workforce is employed informally. And, if they lose their jobs from one day to the next, that means their income disappears. So you need to get help to them very, very fast. And that was a significant challenge in pretty much every single Latin American country, except Uruguay, that had a strong social protection system going into the crisis, perhaps more comparable to what you see in Germany. And they were able to get that assistance to people fast. But otherwise, it was a real challenge. And that was one of the factors that made it very hard to tamp down on the virus as well.
What do we see when we look at these countries' healthcare systems as well? We know that with other regions, that's also been a challenge, is dilapidated or healthcare systems that haven't been invested in, rather.
Overall, yes, because one of the key characteristics of Latin America is the tremendously high levels of socioeconomic inequality. And so you have an underfunded public health sector that serves the majority of the population, and then you have a better resourced private healthcare sector. However, neither were prepared to confront a pandemic of this magnitude, and now you see the results.
It was interesting in that piece seeing how the community comes out. On one hand, the football clubs, on the other hand, some volunteers in the favelas. I'm guessing that might be nice, but perhaps not enough to really make so much of a difference when you're talking about a pandemic.
That's correct. I mean, civil society help is always important, but if you're dealing with a shock such as a pandemic, you absolutely have to have a state that is prepared to confront these kinds of social risks. And unfortunately, most Latin American countries, the weak state capacity has come to the fore with this crisis. And many governments are recognizing that now and seeking to invest more in it.
I want to ask you before we go about Peru. I believe it has the highest mortality rate in the world from COVID still. Any reason for that?
Well, I think the factors that I mentioned. Peru is a country with very high levels of informality. 80% of the workforce is informal. And so when the pandemic hit, they depended on the informal sector for their income, and social distancing was quite brutal, and they couldn't sustain it. At the same time, the government had a really hard time reaching the entire population, and still in August, 5 months later, many people were still waiting for cash assistance help from the government. So in those kinds of circumstances, it's very, very hard to effectively implement social distancing measures. Add to that simply lots of people living in pretty bad housing conditions in urban slums where social distancing is very difficult. Some people don't even have fridges, so they can't prepare, for example, meals for an entire week. They have to go out every day and buy food.
All right, Marika Blofield, director of the Giga Institute for Latin American Studies in Hamburg. Thank you very much. And now it's time for your questions to our science correspondent, Derek Williams.
How long does an asymptomatic person or one who has overcome COVID-19 remain a possible source of infection?
Regardless of whether you have symptoms or if you're asymptomatic, if you've been diagnosed with COVID-19, it's important not to leave isolation until your local health authority says you no longer pose a danger to others. In its recommended guidelines, the WHO says that on average, positive patients who show symptoms could be infectious for up to 10 days after symptoms first appeared. It also says patients should wait at least that long, plus 3 days after they're symptom-free without any medication. So a person with an average case of COVID-19, if there is such a thing, should isolate a minimum of 13 days. For asymptomatic people, the WHO recommendation is to isolate for at least 10 days since your last positive test. Various national health authorities have interpreted those recommendations in different ways. There's no zero-risk scenario, but as a rule of thumb, people who test positive, whether they're symptomatic or asymptomatic, are now viewed as being no longer infectious after 2 weeks.